Okay, so today we will discuss radiology paper number 2, SK22. Lecture number 19 है 62-year-old man is diagnosed with colorectal carcinoma. Which tumor marker is most useful for monitoring treatment response and reoccurrence? तो कोलोरेक्टल कार्सिनोमा में कौन सा ट्यूमर मार्कर आप देखते हो? अमंग्स द फॉलोइंग दैट इज CEA. फॉलोअप के लिए भी CEA यूज़ होता है. A child with anemia, jaundice, splenomegaly is diagnosed with hereditary spherocytosis. Which membrane protein defect is most common? तो hereditary spherocytosis में स्पेक्ट्रिन का डिफेक्ट आपको मिलेगा. ऑटोसोमल डोमिनेंट है डिफेक्ट होता है RBC मेम्ब्रेन, स्केलेटन एंड प्लाज्मा मेम्ब्रेन में. स्पेक्ट्रिन एंड कायरिन बैंड 3 और प्रोटीन 4.2 में. ऑस्मोटिक फ्रेजिलिटी टेस्ट करते हैं इसके लिए. फीमेल प्रेजेंट्स विद स्वेलिंग बिलो एंड लेटरल टू द प्यूबिक ट्यूबरकल. तो बिलो एंड लेटरल टू द प्यूबिक ट्यूबरकल की बात आ जाए उसमें आपने फीमोरल हर्निया लिखनी है. फीमोरल हर्निया डिफाइंड बाय इट्स पोजीशन पासिंग थ्रू द फीमोरल कैनाल. Therefore, the swelling present inferior to the inguinal ligament and typically lateral to the pubic tubercle. 65-year-old chronic smoker है present with progressive dyspnea, barrel-shaped chest. Pulmonary function test shows increased lung compliance with reduced expiratory flow. Loss of alveolar elastic recoil is most characteristic of which disease? तो जिसमें एल्वियोलर इलास्टिक रिकॉयल आपके साथ लॉस हो जाता है ये आपको एम्फाइसीमा में मिलता है. ऑप्शन नंबर डी. अच्छा, ये ऑब्स्ट्रक्टिव और रिस्ट्रिक्टिव डिजीज़ है. यू कैन पॉज द वीडियो हेयर एंड रीड दिस. इसके बाद है 42-year-old प्रोफेशनल पियानिस्ट presents with progressive difficulty in playing the piano. He reports loss of fine finger movements and ये क्या है clumsiness while performing rapid precise hand actions. On neurological examination, muscle strength is relatively preserved, but there is marked impairment of skill, voluntary movement of the hand. Sensory examination is normal. Which neural tract is most likely involved? तो ये स्पाइनोथैलेमिक है या कॉर्टिकोस्पाइनल, वेस्टिबुलोस्पाइनल या रूब्रोस्पाइनल. सो दिस इज़ अ केस ऑफ कॉर्टिकोस्पाइनल क्योंकि इसमें इन्होंने फाइन स्किल्ड वॉलंटरी मूवमेंट्स ऑफ द हैंड की बात की है. तो दैट इज़ ड्यू टू कॉर्टिकोस्पाइनल ट्रैक्ट. Pleural fluid is closely cloudy with raised neutrophils. What type of effusion is this? तो प्लूरल फ्लूइड अगर आपको क्लाउडी और उसमें न्यूट्रोफिल्स ज़्यादा हैं, दिस इज़ प्रूरुलेंट एक्सुडेट. क्लाउडी फ्लूइड जिसमें न्यूट्रोफिल्स हों उसे हम प्रूरुलेंट एक्सुडेट कहते हैं या एम्फाइमा. Patient presents with neck rigidity, fever and altered state for lumbar puncture. Which of the following is ideal site? तो lumbar puncture के लिए above the spinous process of L4 ये ठीक ऑप्शन है. Below L4 प्रेफर करना है, above L5 between L4 L5. Which cardiac structure most commonly compresses the esophagus in pathology? तो esophagus को जो compress करता है that is your option number C, left atrium. A child presents with midline neck swelling below the hyoid bone that moves with trunk protrusion. तो trunk protrusion के साथ movement करता है that is thyroglossal duct cyst. ऑप्शन नंबर बी, thyroglossal duct cyst. ये हमने पिछले पेपर में इसकी एक्सप्लेनेशन डिस्कस की है. A child presents with rigid right iliac fossa pain and guarding. तो इसका डायग्नोज क्या होगा? राइट iliac fossa pain है, साथ में there is guarding. So the diagnosis will be this is a case of acute appendicitis. Option number B. Hormonal changes in menopause. तो एस्ट्रोजन कम होता है, FSH LH इंक्रीज होता है. ऑप्शन सी. Population was divided according to age into groups and subgroups, then randomly people were selected. तो ये ग्रुप्स और सब ग्रुप्स में जब भी क्लासीफाई होगा दिस इज़ अ केस ऑफ स्ट्रेटिफाइड सैम्पलिंग. After RTA, patient presents with half side of the body sensation lost, absent cremasteric reflex, abdominal reflex with exaggerated knee reflex. On CT scan, bilateral anterior frontal lobes were damaged. Which tract will be involved? तो इसमें कौन सा tract involve होगा आपके साथ? That is your corticospinal tract. Patient with ape hand deformity, कौन से nerve की injury होती है? तो that is your median nerve, option A. फिर इसमें जो है patient is hit at the flank region एंड प्रेजेंट्स टू इमरजेंसी विद ग्रॉस हेमाचूरिया, बेस्ट इन्वेस्टिगेशन इसके लिए हम क्या करेंगे, सिस्ट यूरिथ्रोस्कोपी करेंगे। चाइल्ड हैज़ ग्रोथ रिटार्डेशन, रिकरेंट ब्रोंकाइटिस, क्रॉनिक डायरिया, डिफिशियंसी ऑफ विच वाइटामिन, तो इसमें कौन से वाइटामिन की डिफिशियंसी होगी, दैट इज़ रेटिनोइक एसिड। इन राइट शिफ्ट ऑफ ऑक्सी हेमोग्लोबिन डिसोसिएशन कर्व विच इज़ डिक्रीज, तो इसमें जो डिक्रीज होगा दैट इज़ योर ऑप्शन नंबर डी, पीएच। राइट और लेफ्ट शिफ्ट हमने पिछले वीडियोस में डिस्कस किए हैं, यू कैन रीड दिस एडिशनली, या पॉज करके यू कैन रीड दिस। During bronchoscopy, after entering trachea, the structure usually visualized first is right upper bronchus, option A. Patient presents with fever, chill, dysuria, hypotension in ICU, तो इसका cause क्या होगा, that is septic shock. Myelination starts in utero. The correct sequence of myelination क्या होगा, correct sequence among the following क्या होगा, you can pause here and you can think about it। तो इसमें जो आपके साथ करेक्ट सीक्वेंस होगा, पेरिफेरल टू सेंट्रल, रोस्ट्रल टू कॉर्डल, वेंट्रल टू डोर्सल, सेंट्रल टू पेरिफेरल, रोस्ट्रल टू कॉर्डल, वेंट्रल टू डोर्सल, पेरिफेरल टू सेंट्रल, कॉर्डल टू रोस्ट्रल, डोर्सल टू वेंट्रल, सेंट्रल टू पेरिफेरल। ये ऑप्शन डी ठीक लग रहा है, कॉर्डल टू रोस्ट्रल, डोर्सल टू वेंट्रल। A patient with known medulloblastoma later develops multiple colonic polyp, इसका most likely diagnose क्या है, that is a case of ऑप्शन ई, टर्कट सिंड्रोम। टर्कट सिंड्रोम में फेमिलियल एडिनोमेटस पोलिपोसिस होगा, साथ में लिंच सिंड्रोम होगा, मेलेग्नेंट सीएनएस ट्यूमर होगा, तो इसे हम टर्कॉट सिंड्रोम कहते हैं। पेशेंट हैज़ pineal gland tumor causing compression of optic chiasma, the most likely visual field defect इसमें क्या होगा, तो that is your bitemporal hemenopia। बायोटेम्पोरल हेमेनॉप्सिया जो है क्लासिक साइन है ऑफ लीजन कंप्रेसिंग द ऑप्टिक कियाज्मा। होमोनमस हेमेनोपिया ऑप्टिक रेडिएशन में, हेट्रोनमस हेमेनोपिया ऑप्टिक कियाज्मा के लीजन में पाया जाता है। राइट ओसिपिटल कॉर्टेक्स में कॉन्ट्रालेटरल होमोनमस हेमेनोपिया विद मैकुलर स्पेयरिंग ड्यू टू डुअल ब्लड सप्लाई। लेफ्ट ऑप्टिक नर्व में मोनोकुलर विजन लॉस इन द लेफ्ट आई। लेफ्ट ऑप्टिक कियाज्मा में बायटेम्पोरल हेमेनोपिया। राइट लेटरल जेनिकुलेट बॉडी में कॉन्ट्रालेटरल होमोनमस हेमेनोपिया विदाउट मैकुलर स्पेयरिंग। लेफ्ट टेम्पोरल लोब में सुपीरियर क्वाड्रेंटिनोपिया नॉट कंप्लीट हेमेनोपिया। CT scan of the brain shows multiple intraparenchymal hyperdense and hypodense lesion involving deep brain structure. The most likely cause इसका क्या है, इसका most likely cause जो है that is hypertensive intracranial intracerebral hemorrhage। 40-year-old patient diagnosed with pancreatic diverticulum diversum during evaluation of recurrent pancreatitis। Regarding the anatomical relation of the common bile duct, where is it located in relation to the pancreas? तो in location to the pancreas अगर ये located है that is posterior and medial। A newborn is noted to have absent plantar crease, wide spaced toes, flat nasal bridge, low set ears. What is the most common chromosome abnormality in this child? That is your 47। ये क्लाइनफिल्टर की तरफ जा रहा है, तो इसमें 47XXY होगा। एब्सेंट पाल्मर क्रीज है और वाइड स्पेस टोज है, फ्लैट नेजल ब्रिज, लो सेट ईयर्स, तो दिस इज़ अ केस ऑफ 47 chromosome। 45-year-old woman undergoes abdominal imaging for non-specific pain. CT scan reveals well-defined echogenic lesion in the liver. What is the most likely diagnosis? तो इसका most likely diagnosis among the following क्या होगा, that is hemangioma। How many segments does the liver have according to the Conord classification के मुताबिक liver में कितने segments होते हैं, that are 8 segments होंगे। Patient with rheumatoid arthritis has been on treatment for 2 months and now presents with blackening of skin, hyperpigmentation over the anterior shin and bone pain. Which drug is most likely responsible? तो इसमें जो drug आपके साथ responsible है that is hydroxychloroquine, option A। हाइड्रोक्सीक्लोरोक्वीन आपके साथ स्किन हाइपरपिगमेंटेशन और मस्कुलोस्केलेटल सिम्टम्स कॉज करवाता है। ड्यूरिंग एम्ब्रियोलॉजिकल डेवलपमेंट द लिवर पैरेन्काइमा इज डिराइव फ्रॉम विच जर्म्स लेयर, तो लिवर पैरेन्काइमा डिराइव होता है फ्रॉम योर एंडोडर्म। एंडोडर्म से एपिडर्मस, एपिथेलियल लाइनिंग्स है ईयर आई नोज के और एनेमल ऑफ टीथ, एक्सोक्राइन ग्लैंड्स, एनेंसेफेलॉन, आई लेंस वगैरह। एंडोडर्म से फिर डिफरेंट चीज़ें हैं जिसमें लाइनिंग ट्यूब ऑफ नोज, माउथ, ईयर टू एनस, यूरेथ्रा, विजाइना एक्सेप्ट दोज टू बी टच विद फिंगर्स, गट ट्यूब, लंग, लिवर, स्प्लीन, पैंक्रियास, थायराइड, ब्लैडर, एपिथेलियम, ये सारे। मीजोडर्म में आपके साथ गोनेड्स, निमोनिक है, जेनेटो यूरिनरी एंड रीनल। अदर्स में मसल, बोन, कनेक्टिव टिश्यू, सीरस लाइनिंग ऑफ बॉडी कैविटी, सीवीएस और पैरेन्काइमा, नोटोकॉर्ड, न्यूक्लियस पल्पोसिस, एड्रीनल कॉर्टेक्स, ड्यूरा मैटर, स्प्लीन। A patient presents with pain during overhead abduction of the shoulder. There is no local tenderness but pain occurs on active movement. Which tendon is likely involved? इसमें supraspinatus का tendon involve होता है। A patient sustained subtrochanteric fracture of the femur. On examination, the affected limb appears shortened and laterally rotated. तो इसका cause क्या है? तो you can pause the video here and you can think about it. तो इसका जो ओरिजिनल कॉज है दैट इज़ योर ऑप्शन नंबर डी, लेटरल रोटेशन बाय piriformis, शॉर्टनिंग बाय gluteus medius एंड minimus. Patient with history of road traffic accident undergoes surgery for control of bleeding around the hip joint. Injury to which artery most commonly lead to avascular necrosis of femoral head? तो जो avascular necrosis of femoral head cause करवाएगा that is medial circumflex femoral artery. Medial circumflex femoral artery. Medial circumflex femoral artery is the principal blood supply to the femoral head. A young male presents with headache for one day which has been increasing in severity to such an extent that now it is unbearable. He is saying it is the worst headache of my life and is associated with vomiting. He is irritable, having photophobia and neck stiffness. तो इसमें डायग्नोसिस आप किस तरह करोगे? आपने सीटी स्कैन ऑफ द ब्रेन करवाना है। क्रॉनिक स्मोकर प्रेजेंट्स विद लॉन्ग स्टैंडिंग कफ, चेस्ट एक्सरे पे हाइपर इन्फ्लेटेड लंग नज़र आ रहा है। पल्मोनरी फंक्शन टेस्ट पे आपको डिक्रीज FeV1/FeC रेशो, अल्फा 1 एंटीट्रिप्सिन आर नॉर्मल। व्हाट इज़ द पैथोलॉजिकल मैकेनिज्म? इसमें क्या होगा? दैट इज़ बिकॉज ऑफ एल्वियोलर सेप्टल डिस्ट्रक्शन। एम्फाइसीमा है जहाँ पे एल्वियोलर सेप्टल डिस्ट्रक्शन होती है। क्रॉनिक ब्रोंकाइटिस हैज़ मैकेनिज्म ऑफ म्यूकस ग्लैंड हाइपर सिक्रीशन। वुमेन हु फ्रीक्वेंटली वियर्स हाई हील फुटवेयर प्रेजेंट्स विद 4 foot पेन। रेडियोलॉजिकल एग्जामिनेशन पे हाइपरडेंस चेंजेस इन्वॉल्विंग द हेड ऑफ द सेकेंड एंड थर्ड मेटाटार्सल। तो इसका मोस्ट लाइकली कॉज क्या है? दिस इज़ बिकॉज ऑफ ऑस्टियोनेक्रोसिस। 60-year-old man presents with bone pain. Laboratory investigation revealed ALP levels high, normal calcium. इसका diagnose क्या है? That is your osteomalacia, option A. Sorry, that is Paget disease of the bone. Sometime मुझसे क्वेश्चन गलत हो जाता है तो मैं जब उसको करेक्ट कर देता हूँ तो यही आपके माइंड में आएगा कि इसमें Paget disease of the bone लिखना है। A pregnant woman undergoes antenatal screening for chromosomal abnormalities. Which biochemical findings should alert the clinician the possibility of Down syndrome? जवाब के साथ very low AFP होगा, it indicates Down syndrome. तो ये हमने पिछले पेपर में ये सारे डिस्कस किए हैं एक्सप्लेनेशन। आप अगर इसको दोबारा देखना चाहते हैं you can pause video here. A patient presents with difficulty passing catheter due to urethral stricture. Which part of the urethra is the narrowest in male? तो जो narrowest होता है in males में that is your membranous urethra, option number C. अच्छा, ये कुछ डिस्कशन के टॉपिक्स हैं, ये हमने पिछले लेक्चर में सारे कवर किए हैं, ठीक है। इफ़ यू वांट टू रीड इट यू कैन पॉज हेयर। A child presents with ovarian testicular mass, lab shows elevated AFP. तो इसका ट्यूमर कौन सा होगा? दैट इज़ अ केस ऑफ यॉर्क सैक, एंडोडर्मल साइनस ट्यूमर है, ठीक है। सीरस एपिथेलियम ओवेरियन ट्यूमर के लिए CA 125 19 9 आप ओवेरियन ट्यूमर्स के लिए ग्रेनुलोजा सेल्स में हम इनहिबिन देखते हैं, बीटा HCG डिसजर्मिनोमा, कोरियोकार्सिनोमा में, AFP में, एंडोडर्मल साइनस ट्यूमर्स, टेराटोमास देखते हैं. A patient has end diastolic volume 150 and systolic volume 75. What is the ejection fraction? तो ejection fraction इसमें क्या होगा? That is 50%. ये फार्मूला आप पुट करोगे तो इससे 50% आएगा, जिसमें स्ट्रोक वॉल्यूम इज इक्वल टू एंड डायस्टोलिक माइनस एंड सिस्टोलिक. ठीक है. पेशेंट प्रेजेंट्स इन ER आफ्टर RTA, complains of pain in the left lower chest and free fluid in the abdomen on ultrasound. Which of the following is responsible for this? तो इसके लिए amongst the following क्या responsible है? That is your option number D, spleen. 45-year-old patient undergoes surgery for acute appendicitis. During the procedure, the surgeon needs to ensure adequate blood supply to the cecum and proximal colon to avoid ischemia. Which of the following artery primarily supplies this region? तो इस region को कौन सी artery supply करेगी? That is your superior mesenteric artery, ileocolic and right colic arteries. Cecum or proximal colon are supplied by the branches of SMA. The ileocolic supplies the cecum and appendix, while the right colic artery supplies the ascending colon. Other options supply regions outside the cecum and proximal colon, making them incorrect. अच्छा, तो ये एक diagram है. If you want to study these, you can pause the video and check these two diagrams. फिर है pregnant patient is treated case of hyperthyroidism. Now she presents at 6 weeks of gestation with following labs: TSH normal, T4 increase. What will be the management? तो जब T4 increase है, we will give him propyl thiouracil. Thyroid in the first trimester में PTU, anti-thyroid second और third में metamizole, anti-thyroid in thyroid storm में PTU देंगे. Cross placenta affect fetus में metamizole is greater than PTU. Patient has history of gunshot injury. Now he presents with complaint of swelling that appears above the clavicle while coughing or sneezing. Swelling more likely इसमें क्या है? That is due to pleural membrane, option A. Swelling above the clavicle that appears with coughing, sneezing suggests herniation or protrusion of a structure due to increased intrathoracic pressure. This could be a defect in fascia muscle allowing the cervical dome of the pleura or the viscus like the lung apex to protrude. अच्छा, फिर इसके बाद है 46 में which immunoglobulin crosses the placenta? That is your IgG. 30-year-old man falls directly onto his right shoulder. After the injury, he is unable to abduct his arm beyond 15. Though he can flex and extend the elbow normally, examination पे flattening of the shoulder contour and loss of sensation over the lateral aspect of the upper arm. Which nerve is most likely injured? तो इसमें जो nerve आपके साथ injure होगा, that is your axillary nerve. 52-year-old teacher presents with generalized body weakness, fatigue. He gives history of receiving 2 units of blood transfusion. A few days ago, laboratory investigation पे liver function test deranged है 3 times the normal value. तो इसका most likely cause of this condition क्या है? That is due to hepatitis B infection. Hepatitis B virus की वजह से. Okay, this is the explanation. If you want to read it, you can pause the video and read this. Marathon runner has been running continuously for several hours. His muscle and liver glycogen store are completely depleted. Which of the following metabolic process will now primarily provide energy for continuous muscle activity? That is your gluconeogenesis. 62-year-old diabetic patient experienced sudden right-sided weakness and speech difficulty lasting 20 minutes and fully resolving. तो इसका diagnose क्या है? That is due to transient ischemic attack. 75-year-old man presents with urinary hesitancy, weak stream and nocturia, weight loss. DRE पे आपको hard nodular prostate नज़र आ रहा है. This is a case of option number B, prostatic carcinoma. Prostatic carcinoma का केस है. Okay, a patient consume mostly white bread, cream, soup, eggs and rice with little no vegetable or fruit. Which vitamin deficiency is most likely? तो इसमें जो vitamin की deficiency आएगी that is due to folic acid. Improper intramural injection in the buttock most often injures, तो ये sciatic nerve को injure कर सकता है. Patient has elevated level of triglyceride, long chain fatty acid and lipid vacuoles in the muscle due to which of the following? तो ये कार्निटीन डिफिशिएंसी की वजह से. Carnitine is a molecule that plays crucial role in the process. It acts as a shuttle transporting long-term fatty acid across the inner mitochondrial membrane into the mitochondrial matrix. Without adequate carnitine, these long-chain fatty acid cannot enter the mitochondria. They accumulate in the cell cytoplasm, formation of lipid vacuole, increased fatty acid and triglyceride in muscle use. Newborn is submitted with severe jaundice, pallor, hepatosplenomegaly. The obstetric record shows the mother is Rh negative, previously delivered an Rh positive baby without risking anti-D prophylaxis. The current infant is diagnosed with erythroblastosis. Fetal is due to hemolysis caused by the maternal RBC crossing the placenta. तो ये कौन से टाइप का hypersensitivity reaction है? This is type 2 hypersensitivity reaction. What is the most common site of ectopic pregnancy? जो ampulla of fallopian tube है, ये सबसे common site है for ectopic pregnancy. 25-year-old woman presents with oligomenorrhea, infertility, obesity, hirsutism. Which condition is most consistent with this feature? तो इस feature के साथ जो condition associated है that is polycystic ovarian syndrome. Patient presents with fatigue, hypotension, hypoglycemia, loss of secondary sexual characteristic. Lab shows low TSH, ACTH, LH, FSH and GH. What is the most likely diagnosis? That is due to panhypopituitarism. Panhypopituitarism की वजह से. Most likely diagnosis is your panhypopituitarism. Deficiency of all pituitary, anterior pituitary enzymes, hormones. Which of the following is the most powerful transporter in the gut mucosa which causes absorbed stuff back into the gut lumen, that is that is due to glycoprotein. Okay, hereditary spherocytosis में कौन सा प्रोटीन का डिफेक्ट आपको मिलेगा? That is defect in spectrin. 40-year-old woman presents with fatigue, weight gain, cold intolerance, constipation, dry skin. Examination: patient has bradycardia, periorbital puffiness, TSH 12, T4 0.5, free T3 low, normal. Which of the following is the most likely diagnosis? तो ये simple scenario है of hypothyroidism. Together, a high TSH, low free T4 predominantly directly to the primary hypothyroidism, where the problem lies within the thyroid gland itself. Free T3 can remain in the low normal range in early stages of the hypothyroidism. 55-year-old man presents with difficulty recognizing object placed on the right hand and eyes closed. On examination, motor power and primary जो भी है पेन, टेम्परेचर, टच आर इंटैक्ट. तो ब्रेन का कौन सा एरिया अफेक्टेड है? दैट इज़ सोमेटोसेंसरी एसोसिएशन एरिया. स्टीरोग्नोसिस रिक्वायर integration of sensory information which occur in the sensory association cortex. Signs of pericarditis such as sharp chest pain relieved by sitting forward were given. The question was asked which layer is pain sensitive. So that is your parietal pericardium. That is your sensitive. Patient develops malignant hyperthermia during anesthesia. Which drug is most likely responsible? तो इसमें जो ड्रग रिस्पॉन्सिबल है दैट इज़ योर ऑप्शन ए सक्सिनाइल कोलिन. सक्सिनाइल कोलिन is depolarizing muscle relaxant, triggers malignant hyperthermia, is generally susceptible individual due to abnormal ryanodine receptor activity. Female after RTA has difficulty opening her mouth on examination. The mandible deviates on protrusion and jaw protrusion is weak. Which of muscle attaching to the TMJ capsule is affected? तो जो affected है that is your lateral pterygoid. Lateral pterygoid provide करता है stability को and protrudes and stabilizes the mandible. Injury causes deviation towards the affected side during mouth opening. एलिवेशन ऑफ jaw में आपके साथ आपने मैम याद रखना है MAM. 6-month married couple has visited fertility clinic with complaints of subfertility. Couple states that they have been having regular unprotected intercourse for 2 to 3 weeks per day but has not conceived yet. What is the approximate percentage of couple who conceive within 1 year of trying? That is your option number B, 80%. Patient underwent hysterectomy. Surgeon should know the relation of ureter where it can be damaged during hysterectomy. तो ये जो डैमेज हो सकता है that is your that is actually your option C when it moves upward and laterally behind the broad ligament. Okay. Where a patient presents with regular upper quadrant pain and mass is seen in the right lobe of the liver, the structure derived from which germ layer? तो ये जो structure है it is derived from option C, endoderm. A patient imaging shows calcification of gallbladder wall and penetration of hepatic flexure. What is the most likely diagnosis? जो most likely diagnosis है that is your gallbladder carcinoma. Gallbladder carcinoma. A patient presents with chronic diarrhea, abdominal pain. Which vitamin deficiency is most likely? So that is niacin. A girl is lifting heavy weights in the gym. She suddenly experiences muscle weakness and drops her weight. Which structure is responsible for this protective mechanism? So that is your Golgi tendon organ. A pregnant woman has abdominal pain. Labs pay HbS Ag negative, anti-HbC IgG positive, HbE Ag negative. What is the mechanism behind this serological pattern? So that is previous exposure to HBV, hepatitis B virus. APSI is characterized by which classic trial? So APSI is characterized by candidiasis, hypoparathyroidism and Addison's disease. A patient experiences one-sided weakness without sensory loss. Which part of the internal capsule is affected? That is your posterior limb anterior part. Posterior limb anterior part. Child born with urine coming out from umbilicus diagnosed as patent lumen of allantois, which results in which of the following? So that is urachal fistula, patent urachus. U wave and flat T wave were seen. Which electrolyte disturbance? So इसमें जो electrolyte disturbance है that is hypokalemia. Patient presents with trauma and bleeding from the junction of 4 bones on the side of the skull. That is due to Tyrion. 10-year-old boy presents with fever, migratory joint pain involving the knees and ankle. He has a sore throat 3 weeks ago that resolved without treatment. On examination, his joints are warm and tender without deformity. Cardiac accumulation reveals soft systolic murmur. Laboratory investigation पे आपको elevated ESR नजर आएगा. Which of the following finding is representative of director for the diagnosis of rheumatic fever? तो rheumatic fever के लिए हम क्या चीज़ देखते हैं? That is option number C, Sydenham chorea. present in home Korea. अच्छा फिर उसके बाद है patient presents with palpitation, heat intolerance, sweaty hands and gritty eyes. What is the most likely diagnosis? This is a case of Graves' disease. Patient presents with shortness of breath and cough, arterial blood gas पे आपको PO2 70 mmHg, pH 7.35, HCO 316 and PCO2 60 millimeter Hg. Identify the acid base abnormality. So that is your option C, respiratory acidosis. So for today this was enough. Hope you liked the video. Please do like, share and subscribe with your friends. Thanks for watching. Inshallah see you in the next video.